There you go. So good afternoon, everyone. Thank you so much for joining us again in one of these Montefiore Nyack Hospital community chats. Today, we are partnering with Health First to celebrate the last day of Women's Health Month. And of course, we say health because we're all about health in Montefiore Nyack. So today we're going to be talking about a very important topic, which is prenatal care, but not only prenatal care by itself. The fact that we're going through this COVID pandemic puts an extra layer on everything that we're doing now. So let's talk about how prenatal care is done now that we have COVID going on. And for that, we have invited Kara Stanley and Patty Guzman, and they're going to be introducing themselves in a minute and telling you where they're coming from. And, you know, it's not the first time that we have Kara and Patty here. They're great speakers. So I'm excited to have you again. Welcome back. And then we have Patrick, as a representative of Health First, who is going to also be talking to us about all the great programs that Health First is doing for the community here in Rockland County. So Kara, let's start with you. How are you? Nice to see you.
Oh, thank you so much, Sandra. I'm glad to be here. I'm doing fine, thank you. It's a little gloomy outside, but there's a lot of joy in my heart, so I'm really happy to be here.
Great, thank you so much. So Kara, tell us a little bit about yourself and where you work.
Sure. I actually work, as you know, my name is Kara Stanley, as we just said. I work for Lower Hudson Valley Perinatal Network. And as an organization, we actually help pregnant moms, prenatal moms, postpartum moms, but we also help, we have a prep program that deals with our adolescents to help them focus on their goals versus focusing on sexual activity, as well as we have a breastfeeding program called the Baby Cafe, which helps moms with breastfeeding. I am the coordinator for the It's About You, Mitch, It's About You home visiting program. We have a healthy families program within, like I said, within our organization. And my program is a home visiting program. And the idea is to really talk to and assess moms' needs, whether it's prenatally or postpartum, so we can get them connected to the resources that are available to them and what really matters to them and trying to address that, as well as helping them to achieve their goals.
Excellent. Thank you, Kara, for that. Patty, tell us a little bit about yourself.
Hi, I'm Patty Soriano Guzman. I'm lactation consultant at the Montefiore Nyack Prenatal Center, where we offer obstetrics-only care all through pregnancy through 6 weeks postpartum. So I have the pleasure of working with mothers on breastfeeding education, lactation services. In addition to that, we also run the New Moms Circle, which is a social group support for anyone in the community. It's free of charge, and we have various parenting related topics and offer support to mothers, a place to come, talk about any of their concerns or curiosities, and also offering education and resources.
Thank you. Patrick, tell us a little bit about you.
Hello, I'm Patrick Dupay from Health First. Do community engagement for Rockland, Orange, and Sullivan. So again, I'm excited to partner up and join forces with Montefiore and Lower Hudson Valley Perinatal Network. And, you know, just to be able to work in the community, help in the community, collaborate in the community to help educate what we have to offer with plans and things of that nature, and to help in a sense to provide the education for better health outcomes is always obviously a plus for anybody. So, you know, enjoy being a part of this and happy to be here.
Thank you. So let's get into business. Obviously, prenatal care, you know, we know it's very important, but I know there is still a lot of people out there that don't see prenatal care as the most important thing. I think that, yes, pregnancy is a natural thing, right? We could think that, you know, as it happens naturally, we don't need major care to it. But however, we do understand that prenatal care is very, very important. Why is that so, Kara?
Well, prenatal care is important because when a person gets to really connect with their doctor, it's a way of helping them to have a healthier birth, right? It's also a way of helping them to be healthy within themselves. Because as mothers, sometimes we don't really take care of ourselves, not because we don't want to, but because there's so many other things going on. But once we know that we're pregnant, if we can get, even before pregnancy, however, you should start thinking about that. But when you're pregnant, you should definitely get prenatal care so you can make sure that you're really helping to have a healthier birth. We know that if a person doesn't get into prenatal care early enough, they're 3 times as likely for those who don't have prenatal care to have a low birth weight baby. So the idea is that we encourage them to, within our organization, to make sure that they get to their prenatal care as early as possible because we know the importance of it. The idea is to be as healthy as you can and to make sure that your baby is as healthy as they can, even if they're in utero.
Mm-hmm. Patty, do you have anything to add to that?
Yes, absolutely. Always the goal is a better health outcome for mother and baby. And as soon as a woman knows that she is pregnant, it would be really in her best interest and her child's best interest to seek care and guidance. Now, I find that there is a growing movement towards looking at other options. So it may be a doctor, it may be a midwife. There are all kinds of different ways of going about it. But I think the number one thing is definitely to start building up that circle of care, okay? And it is critical for the mother who's planning a hospital birth that she starts seeking out her options early and pick the best fit for her in terms of a provider that's really going to help her meet her goals for her birth.
Now, you're saying a couple of things here. Yes, Kara.
I also wanted to share that with them getting into care early, it also helps to spot any problems that might be existing, right? That they may not be aware of. It allows them to have a conversation with their provider, and to Patty's Patty shared, whether it's the midwife, whether it's the doctor, whoever they're utilizing as their provider, to talk about some of the risk factors that they may not have even considered within their own lifestyle, whether they have diabetes, whether they have hypertension, some of the chronic diseases that actually affect our moms. But if they get into care early, they can have those conversations so that their birth outcome can be a better one.
Mm-hmm. And Kara, I was just gonna say, we're talking about prenatal care, but you're mentioning 2 people. You're mentioning the mom and you're mentioning the baby. So, you just spoke about the importance of prenatal care for the mom and to try to detect if there is going to be a problem with the pregnancy for the mom. And then early on, you said also the low birth weight, for example, for the baby. Is there, I think that as women and as pregnant women, sometimes we forget about ourselves, but we never forget about our children. So why is prenatal care so important for our babies?
It's important because our babies are depending on us as the mother. We're the carrier of the child. And in doing so, we should have a better understanding of what it takes to really to have a healthy birth outcome. And sometimes we're not aware of that, because if we were I would say just about in all cases or most cases, we would do things differently. But a lot of times we're not aware of some of the things that's going on and how it will affect our unborn child. As we learn, we then have a better understanding, and then we change behaviors, because sometimes it's a behavior change that needs to happen that would help the birth outcome to be better. And that's why I say it's not necessary, it doesn't really start prenatally in terms of caring for your system to really make sure that you have a healthy birth. But I think, we may get on that later.
Mm-hmm. Yes. And now that you say about behavior change, smoking, for example, if you're going to get your prenatal care, is smoking something that you're going to be talking about with your doctor as well? Let's say you're having a hard time stopping smoking and it's something you want to do. Is that something that the doctor during prenatal care is going to be helping you with?
Are you asking me or Patty?
Anyone.
Patty, you can take it. I'll join after
That's
you.
definitely part of the picture for the mother that has that concern, whether she herself is a smoker or has smokers in her household. It's certainly addressed as part of the bigger picture. And there are smoking cessation programs that we provide information, resource, guidance, and referrals when necessary. But it's important that with smoking or any other health concerns, that there be guidance of a doctor, right? And that it be something that is gradual, not something that's from one minute to the next, because that can put the body under stress and duress and have adverse effects as well. So we're always gentle and respectful of the mother's situation, providing the information and the guidance as we go.
Go ahead, Kara.
And for us, in addition to what Patty's doing, and I'm sure Patty does this as well, we also talk about the different types of how smoke can affect, whether it's first-hand, second-hand, or third-hand smoke. And most people are not aware of even what third-hand smoke is, which is where the smoke is inside of the clothing. It could be on the dog, it could be in the carpet, and how these things would affect the atmosphere that's in, or the environment that the baby is around. So it's really doing the assessment and really helping the mom to get a better understanding that having these things in her system is not really conducive for having a healthy birth. But it's also about transitioning the person off, because sometimes taking people off cold turkey may not work for everybody. Into the substance abuse issues, we try to make sure that we talk to them about substance abuse and how that may affect, and not just regular cigarettes. We also have conversations about marijuana. Absolutely. And not just smoking it, but eating it and then drinking it, because it comes in so many forms at this point. But we also do have conversations surrounding those things.
Which I think it will be an excellent topic also for like a new community chat, like the different uses of marijuana and when it's healthy and when it's not. So definitely, thank you for the idea. We'll be talking about that in the coming future. So Patty, question, when should prenatal care start? Because, I hear doctors say, even when you're thinking about conceiving, it's when you should start. But then some other people say, no, 4 weeks pregnancy or 12 weeks pregnancy. Like, what's the ideal?
Well, for those that are planning, definitely being prepared, and I think Kara alluded to this a little while ago, that it starts with our general health, right? And being in optimal general health gives us better, I think, odds, right, of having that healthy birth outcome. So it really starts from whenever the thought enters. But the statistics also say that a good 50% of pregnancies are unplanned, and that stands true today. So when we have that kind of situation, as soon as a woman or a person is feeling differently, changes, or has any sort of suspicion, that's a good time to verify the pregnancy. And then soon after, start seeking the provider of choice, looking into options, whether they want a home birth or would like a birthing center, if that's available to them in their area, or in a hospital. So really early on. At the prenatal center, we find that most women arrive to us around that like 14 to 16 week window, really. And by then that's, past the first trimester. So it would be good, I would say, in my personal opinion, as soon as a woman knows, definitely like 8 weeks, because there are certain tests that can be administered if needed early on in pregnancy, non-invasively, in terms of blood work and the such. Let's say a woman over 35 that is, for whatever reason, might have a concern. So it would be good to have blood tests done early on and not have to wait until 20 weeks, let's say, to have an amnio. So that's just one example. The benefits of starting early.
Kara.
To add to what Patty said, which was great information, Patty, thank you so much. What we also we share with them is in their what we call the preconception stage, which is where a woman has never had any children. And we also talk to the men, because I know prenatal, we think about the women, but the men are involved too. Without them, we couldn't be in that state. So what we share with them is about thinking, if you are eating healthy now, let's think about eating healthier. What does your diet look like? We talk about nutrition. We talk about exercise. We talk about getting your yearly physical, and what does that look like? What is needed? We also talk about going to the dentist on a regular basis as well. all of these things will contribute to really preparing yourself for conception, because Patty is right. 50% of pregnancies are unplanned or unintended. But if we can get people in a mindset of, let me see what I can do to get my body in the optimal health, so whenever pregnancy happens, it doesn't really matter. They're already in that, their body's already ready. We talked to them about taking folic acid and how important that is. And to start early, start with making sure you're having that in your cereals and those things, so that even if you do get pregnant, your body has folic acid already in it, built up, so that, you know, you can transition into the prenatal cycle without any problems. So it's about really starting in that stage when you've never had children, or you've had pregnancy but you haven't given birth, where you can really get your body in the optimal health and shape for conception.
And not for nothing, but you guys are talking and then more and more questions are popping in my head, you know. So for example, you just spoke about the parent, like the father, you know, but I have to say in today's society, it could be two women, it could be two men who are adopting, you know, it could be not necessarily a woman and a man. So if there is prenatal care, do you think that prenatal care services take into consideration these new type of families that we're having? Because I think that's important as well, you know, to consider those changes.
I think it's good to consider those type of families, because you, in terms of how does a family unit help in the prenatal stage, are the supports that's there, that's needed, because you want to make sure whoever is carrying the child has their stresses under control, because stress can affect the pregnancy. So you want to make sure that whatever the family is, a family unit is involved and is helping with supporting whoever is pregnant. In terms of the other partner, when I said that, I was saying it from the standpoint of, you need a healthier sperm, okay? Because it's going to be a sperm and egg that's going to come together. So you need that person to be, whatever that sperm is, to be as healthy as possible. So in talking to the person, you need to talk to both parties that it's coming from, so to make sure, or to know that the other party, they're as healthy as possible, so that the pregnancy can be as healthy as possible.
Great, thank you, Cara. Patty, would you like to add something to that? Like, for example, in the prenatal center at Montefiore Nyack, do you have couples, you know, that are same sex and they're having children? How do you treat these couples?
In the same way, in general, where we always have an open door in terms of, and we're talking more pre-COVID, right? And in general, but just always being inviting of the partner, the co-parent, and even other family members that are part of the person's support system. Again, going back to that circle of care, you know, the birthing partner, whether it be the father or, you know, same-sex couple or not, plays a really integral role in supporting the woman through her pregnancy, through her birth, and postpartum, through life, actually. So when it comes to same-sex couples, if there's any additional questions, concerns, always, you know, providing as much support as possible. And we happen through our childbirth education program at the hospital in general, it's not just the prenatal center. We have had same-sex couples join us for a number of classes. And honestly, we've really expanded and broadened and being very welcoming and not just being heteronormative in our approach. So I would say what I would like to see is maybe resources that also address the changing landscape, and that families of all kinds to be represented in all of our materials and in our approach.
Yeah, that is great to hear that we are advancing with society as well, right? And then, Cara, you mentioned two things that to me as a dietitian are very important. You mentioned prenatal vitamins, you mentioned folic acid. When should you start taking prenatal vitamins and folic acid? And what are they for? Why do we need them?
Well, the folic acid is to help to prevent birth defects, okay? And you can need to take those, you can take them before you get pregnant. And you also need to understand that it's in your food. So there's certain cereals that you need to look at what's in the cereals, that you can get it that way. It's in certain vegetables, you can get it that way. So you need to look at that and get them in to eat as much of it as you can. That's healthy, and so that you can really help prevent birth effects in your child. Prenatal vitamins, they usually start them during their pregnancy in the prenatal stage. I don't know if they have them before then. That's a question that maybe Patty can answer, but I do know that the other vitamins that you need, regular vitamins, you need to think about taking them, even multivitamins, just to be in a healthier position before pregnancy, that you help with having a better birth outcome.
Yeah, and I'm glad that you're saying that, because something that I have noticed is, prenatal vitamins, usually just over the counter, they cost so much more than multivitamins, and especially if they're branded, obviously they cost even more than just the store brand. And when I look at the difference between prenatal vitamins and multivitamins, it's really nothing. So, I've always thought, as long as you're taking some multivitamins, you're going to be okay. You don't need to pay for the expensive ones. What do you think, Patty?
I think I would say it's fine if you're planning to conceive and planning mode to stay with a basic multivitamin, because there are some subtle differences when it comes to the prenatal vitamin with certain nutrients that can be of concern. And without getting into too deeply what those nutrients are, we want to make sure that we have safe levels. And oftentimes some of the premium vitamins will include some of the herbs or the supplements that are safe to help support our body systems. And sometimes that's what you're seeing in the difference for, say, a whole food-based vitamin or something like that. But I think it is important to start. You can start prenatal vitamins at any point in time when planning to conceive and trying to conceive. Throughout the pregnancy, it certainly is recommended that it be a prenatal vitamin. And even postpartum while breastfeeding, again, going back to the different nutrients, the level of the nutrients, and to ensure that it's safe for mother and baby.
Now, do you think that prenatal care is important only during the first pregnancy, kind of like a lesson to learn, or is it important in each pregnancy?
Each and every pregnancy. I'll just jump
Okay.
in there. I love that question.
I agree with you, Patty.
Because people sometimes they might feel like, oh, I've done this once, I know how to do it now, this is my 7th child, why do I need prenatal care?
But every pregnancy is different. And because of that, you wouldn't want to, in my own terms, I wouldn't want to shortchange the 2nd baby or the 3rd baby from getting the best care possible. So yeah, it gives them an opportunity. Every pregnancy is different, and your body does change over time.
It does.
So to look at it from that standpoint to understand how important it is.
Okay. Well, and now let's get into the topic of COVID. If you're pregnant, I know that in the very beginning of COVID, they were saying, oh, if you're pregnant, you don't have to worry because you're not going to get coronavirus. Is that still the case? I mean, was that even true? Patty?
I think that early on, because it was so new and so extreme, and it was very unknown. So we want to protect, our pregnant mothers and our newborn babies, the most vulnerable in our population. But in fact, I mean, anyone can contract the coronavirus. Pregnant women do and are at higher risk. Okay, so the pregnant population is considered to be higher risk for severity of illness. And that's really important. So it's not that pregnant women will definitely get coronavirus. We don't know how sick a woman can get. It's very possible to have coronavirus and be asymptomatic. And I think in the hospital environment, we've seen plenty of that as well. But it is just important for all populations to be following the guidelines and precautions, especially of pregnant women, because like other viruses and diseases, like influenza and other SARS viruses in the past, we have seen that the severity can be much more in a pregnant woman, and especially if there are other health concerns.
I would also say if she's pregnant and she sees she really should not take it lightly. If she's experiencing any of the symptoms, she shouldn't just treat it as if it could be a common, I just have a common cold. She really should talk to her provider immediately because of all of the things that comes with the coronavirus. And you don't know how to piggyback on Patty said, you don't know how it's going to affect you. So you may want to, we would suggest that they speak to their provider as soon as they're feeling any of this, at least talk to them, feeling any of the symptoms connected to a cold or to, the coronavirus itself.
And Kara, can you pass the coronavirus from a pregnant mom to an unborn child?
Based on the things that I have read, okay, I haven't read anything that says that you can pass it to the unborn child. I've read things that you can pass it once a child has been born, and that's why you should wear a mask even when you're breastfeeding and you're in the room, and wash your hands, follow all of the precautions that have been out there for us to keep one another safe because of the fact that you're in such close proximity to the unborn child. But to my knowledge, I don't know of a mother being able to pass it to her child in utero. Patty, I don't know if you may have heard anything.
The same in terms of what I've read in terms of COVID, and we're still learning and data still being gathered and shared. But again, going back to other viruses and diseases, it is not believed to be passed in utero or very low risk of being passed in utero. And then in terms of the actual birth and the establishing of breastfeeding, if a mother is mildly symptomatic up until the point that she is able, willing and able, she should very much still have her natural vaginal birth because there are inherent protections in having a natural birth. She should still be doing the skin to skin time, the golden hour, and also be establishing the breastfeeding because breastfeeding and breast milk are the baby's best protection in general. So again, following the guidelines, the safety guidelines of having a mask, hygiene, having the assistance, in the labor and delivery room as well as in mother baby, all of those things are important.
Yeah.
Okay. And go ahead, Kara.
And we have encouraged the same because it's important. We don't want mom and baby to lose the bonding time and the bonding with each other and the health that's coming from breastfeeding due to COVID. Because we want them, because remember, breastfeeding also gives babies antibodies as well. So we want to make sure that we encourage moms to definitely breastfeed during that time if she's able to.
And do you know of any cases where there has been a higher incidence of miscarriages or early births due to COVID?
The jury is still out on that one. I think we need to gather more data, but anecdotally and what we've seen, mothers are carrying to term. If they're having mild symptoms or mild disease, there are women who are having COVID and recovering from COVID, and they're able to do so at home. So in those instances of mild to moderate, she is still very much able to carry fully, and just having that care and tending to her needs is really important.
Yeah, a few months ago, we actually had an infectious diseases doctor. We also had a doctor in pharmacology talking about, the importance of the coronavirus vaccine. And one of the topics that we were touching on was if pregnant women should be getting the vaccine or they shouldn't. Again, this was a couple of months ago. I don't know if any of you were present for that community chat, but there was certainly this controversy. So I'm just curious, Karen and Patty, what do you think? I know that nothing is scientifically proven at this point with the coronavirus, and especially for pregnant women. And me, myself, I've been reading, and there is some research that says, yes, totally, and some others says like, try not to. So I'm just curious about what your recommendation is, regarding the coronavirus vaccine for pregnant women. Like, what's your personal opinion, Patty?
My personal opinion, and also based on what I've read most recently, is really that it's an individual and personal decision to make that is different for every person out there, every family unit. And it really, it's important to seek the guidance of your primary care physicians, of your OB and doctors, and figure out what's your risk factor overall, the benefits versus risk ratio for taking or not taking the vaccine. There's no right or wrong or anything that anyone should be doing. What changed from the early days, and I think it depends on the organization you looked at in the early days to now, is that pregnant persons should not be excluded or limited from taking the vaccine. Where I think beyond the recommendation was to maybe hold off from pregnant population as well as children, right? Our most vulnerable and our most vulnerable population that we really need to protect. Now, a year later, it is basically take it on a case-by-case basis, see what the concerns are. And if the benefits outweigh the risk, it should certainly be made available to any person wanting the vaccine.
Mm-hmm.
We say the same. We actually share with our moms if, to speak with we encourage them to speak with their healthcare provider because it is a personal choice and we want them to feel as comfortable as possible with the decision that they have to make. So like I said, we encourage them to speak to their healthcare provider and because they will know what some of their pre-existing conditions are and the things about them as a patient. So it's better for them to have that conversation with their provider in order to make a decision that they themselves and their families are comfortable with.
Mm-hmm.
I do know that recently Johnson & Johnson has started a trial with pregnant moms and the vaccines, but I believe that's very, very recent because it wasn't being done before, to my understanding.
Yeah, unfortunately, anything about coronavirus, even though now we've been into this new world for a year is not enough to learn everything about coronavirus. And we still are in this trial and error kind of period. So that's what I was just curious about your own opinions. But I think that, yes, people should check with their doctors because it's a personal choice, but obviously, we are all different as well. So some people might be at a higher risk, some people might be at a lower risk. And I think that it's important to have that discussion with the doctor that knows you well. Now let's talk about breastfeeding. Yes, Patty.
Just one more thing I wanted to add to that is the importance of following the precautions and the safety guidelines, whether or not a person gets vaccinated, including pregnant women. It's still very important to, try to limit too many public outings, wearing masks, keeping social distancing, the hand hygiene, all of that can go a long way in terms of preventing. And so really that's the best line of defense at this point as far as we've seen.
I just wanted to add that we also need to remember the importance of self-care during the postpartum period, because once you've delivered, your body is still in the healing process, right? So you want to make sure you do as much self-care and eating properly and keeping your immune system built up, because you want to make it harder for the virus to get to you. And after you've delivered, a lot of things is happening in the body. So you want to make sure that we practice self-care, get rest, eat right, do your exercising, drink the lots of water, so you can make sure that your immune system is built up, especially if you've just had a baby.
And now that we're talking about immunity, so let's talk about breastfeeding and COVID. And I know, Patty, this is like your area of expertise as a breastfeeding consultant. You love to be asked this question. So please talk to us about that.
In reference to the benefits of breastfeeding to mother and baby.
And especially during COVID,
Okay, so as I mentioned earlier, and you're right, lactation is my first love. So in terms of, upon birth, establishing breastfeeding as soon as possible is so important. And just having the understanding, like I'm a huge proponent of any childbirth education and preparation during the prenatal phase or as early as possible prenatally. And just having that understanding that your milk is the baby's best protection. That first milk, the colostrum, is a natural vaccine for your baby. It's concentrated nutrients and also concentrated antibodies and hormones that are coating the digestive tract and establishing the baby's immune system. And only human milk does that. Okay, nothing else does that. So it's so important for those first 3 days, exclusive breastfeeding, baby to breast, all the nurturing at the breast. And then for 2 weeks, it's colostrum and mature milk. So around 3 days, that mature milk starts to come in, but that process of establishing your baby's immune system is going on for at least 2 weeks.
Mm-hmm.
And it's so critical for your baby. It's the baby's best chance.
Mm-hmm. And they call the colostrum baby's first vaccine as well. So I guess if you get the colostrum, you obviously don't need to be thinking about COVID vaccine.
Exactly, especially, so there is lots of natural medicine and natural science to be gained there when it comes to breastfeeding and establishing the breastfeeding, but it's more important now more than ever. And again, if mom is positive asymptomatic or mildly to moderate symptomatic and is willing and able to breastfeed, it's so important to just maintain that natural process because only the breast milk does that.
Mm-hmm, mm-hmm. And Kara, I have a question for you because a little earlier we were talking about, all these social gatherings and all of that during times of COVID might not be possible. And I think that when you're expecting, it's such a beautiful time to share with family and friends. You want to show everybody your belly and have people rubbing your belly, and you have now the gender reveal and the baby shower and this and that. It's a very social stage of your life. So how are you convincing moms to stay at home and not do all this partying that you were waiting to do, once you found out that you were pregnant?
I can honestly say the moms that we've spoken to, they're really trying to stay at home because we have a lot of moms who are more afraid of really contracting the virus because of how it may affect, just everything. So especially in the earlier days of the virus. So what we've shared with the mom is how to do it. So having the Zoom parties, where you can do all the things that you want to do, kind of, sort of, and everyone can share in that, but yet you're still protecting yourself from the virus. If you're going to have a gathering at your home, please make it small, because some people you just can't, they just won't, they're going to do what they want to do anyway. Mm-hmm. So we're encouraging them to remember to practice social distancing, to do it outside in a park, perhaps. We make suggestions of places. If they have a backyard, make sure it's, try and have it in a backyard where you're in open air. Don't invite a whole lot of people. Those others who can't attend, tell them, we love you all, but we can't have you here, but we can put you on Zoom. So you'll have them on Zoom and the other individuals at the house, and to really practice social distancing and to make sure that we tell them to have everyone wear their masks when they come. And even we try to also help them to be creative. Maybe you can have a funny mask that has what color the baby is supposed to be. You can do your gender reveal that way. So it's about giving them creative ideas to still make the whole process of having a baby to still be fun in spite of what's going on around them. And we also share with them the importance of support, because support is so important that we don't want them to isolate themselves, because isolation has become an issue as well. So how do you do that by keeping safe? And that's why it's important for us to share different creative ideas for them to help them to prevent the isolation, to hopefully diminish the amount of postpartum depression that happens, as well as be able to have them to still enjoy the whole process of pregnancy and birth.
Yeah, and Kara, you just reminded me that a couple of weeks ago, I attended a baby shower for one of my friends. I had forgotten about that, but the funniest thing is, usually when you use Zoom, this is what you see, right? We couldn't see her belly. So I was like, no, you got to stand up and show that belly, girl. So, she stood up and she showed her belly, and we were all like, oh my God, we can see your belly. And what we all did was we mailed the gifts, early on, so that she could get them before the Zoom party and she could open the gifts in Zoom. And
drive-bys. We thought about drive-bys where she comes out, everybody drive by, they could see her belly, and those things help them to really enjoy the moment, because it's this, the moment is still here. You don't want to take it away, but how can you do it safely? Because that's what you really want. You want to do it in a safer environment for them.
Absolutely. Yeah, and it can still be fun. I think that, you know, in times of crisis, creativity really, it's a good thing. You know, we have to come up with a lot of new creative things. So it's different, but it's new and it's good in a way.
I know for us, we've done community baby showers via Zoom, where the moms who have attended, because there's some moms who don't have a large group of people, a large support circle. So what we've done at our organization is to have community baby showers. And some of them said, wow, this is so great. It was better than one if I had it in person.
And you don't have to think about getting a new dress either, you know?
One of them said, I don't even have to get dressed. I could just sit on my couch and I have,
Yeah,
and they had
save
a really
money.
and everything. So yeah.
Absolutely. And that's exactly, you know, it leads us to my next question. What are you and what is your organization? And we can just continue the conversation with you, Karen, then Patty. What is your organization doing to help all these pregnant moms in Rockland at this moment?
So we, through our home visiting program, we actually make sure that we assess the mom's needs, right? To determine what is it that she needs best. During the pregnancy stage, we do have something, we go through something called baby basics with them, where we take them through each stage of their pregnancy and help them to understand what's going on, so they could also be able to write down their questions and share it with their providers. We also have them doing birth plans, so that they have a really good understanding of what they want to do for their birth, and they can share it with their provider, so they feel as though they're a part of the equation. It's not just about them walking into the hospital and everybody dictating to them. They're sharing what their thoughts are and what their hopes are for their birth, okay? We also do things like have stress management workshops, which is an evidence-based workshop to help prevent postpartum depression, because we do realize that, you know, 30 to 80% of people suffer from baby blues, and then you have those that suffer from postpartum depression. So we try and do that. We also do various workshops to help with parenting, like Parenting Journey, which is also evidence-based. And we also thought about the stress that comes with pregnancy. And so we've done a financial literacy workshop to help them, knowing that babies come with a lot of expenses. So we wanted to help them to know how to manage their money better, so that it doesn't hit them as hard, you know, and they could really go into this new birth or this new addition to their family with a good sense of how we're going to really afford to do this, or just deal with our money differently. Our community health workers work one-on-one with our moms, doing home visits, but now normally it's in the home, but what we do is we do it virtually now, whether it's by phone or by .me, which you can see the person. As well as we do other things with our moms, just to make sure we deliver packages to them, like diapers and clothing. And if they need a crib, we've given them a crib, like a cribette kind of sort of. It's more like a pack and play. We've done, if we have a family that we realize doesn't have a car seat and we have them, we will give them a car seat. You know, we try and really accommodate our moms so that they don't feel the burden of some of the things that hits them during pregnancy. We've even gotten someone to volunteer, an organization to volunteer to send blankets, to have blankets for our moms, and quilts for our moms that are handmade. So it's these things that help to lift the mother and put her in a place where she feels as though there are people that care, that are around her. And we work with her on a one-on-one basis. And not just her, I don't want to say it's just the mother, because we work with the family, honestly. If her support circle, whether it's, or whoever her partner is, we pull the partner in, we make sure that if they want to be a part of the home visits, we have them there. If they want to be in the workshops, we have them there. The idea is to make sure we are addressing all of the needs of the family, because the family is what helps the unit and takes away some of the stress and takes away some of the things that are going on in each household. So the family feels supported, because if the family supported, then the mom feels supported, and we're there for them.
That's excellent, Kara. And We should mention that, with the hospital, Montefiore Nyack participates on various coalitions in partnership with Lower Hudson Valley Perinatal Network. So part of what we do, plugging into the community and providing that support, is to partner with other organizations, make sure that all of these resources and all the information is getting to the mothers that come to us for care. I don't like saying patients, because at the end of the day, what we would hope for and expect is a healthy mom from the beginning, right? So it's making sure that she has all the resources. Again, I mentioned the New Mom Circle, and even from the beginning of the pandemic, we quickly went virtual with the New Mom Circle support group. And from that going virtual, we really shifted to self-care. I know Kara's mentioned that several times, but it's been the primary and overarching theme for all of our various topics and discussion. And also to touch upon that perinatal anxiety, the depression that can happen at any time during the pregnancy, right? And certainly postpartum is real. These mothers are feeling the pressure of the isolation and the limitations, and really being limited in who they can engage with and when they can engage and how they can engage. So providing these social support groups, making it accessible to mothers by having it virtual has been a really big step. We also at Montefiore Nyack transitioned all of our childbirth education classes to the virtual environment. These are fee-based, yet they are very moderately priced, just taking into the consideration the needs of the community. And of course, if there's any sort of financial constraint, by all means, we encourage mothers to communicate that to us so that we can be supportive and help out. But education and preparation is key, not only into helping resolve the worries that can come as part of pregnancy in general, and certainly during the pandemic, but being able to be part of the decision-making of whatever it is that comes up through the pregnancy, whether it is some sort of general health concern or COVID. We want the mother and her circle of care to be part of that conversation. And for it to be something that she's participating in. Okay, so mom is always calling the shots. And the best way to do that is to self-advocate, to be prepared, to be informed, so that you can give informed consent if and when it's needed. That's really important to emphasize. We also have various free print resources available at the prenatal center and the maternity center. We pulled together quickly a lactation telehealth list to help our patients postpartum receive the breastfeeding support that they need at home. So it's much of an environment like this. I'm actually sitting in, the area where we do our telehealth with our patients, and there's a lot that can be achieved. So yes, we have some limitations, but where there's a will, there's a way. Being very creative on how you are engaging in this new normal, communicating with others, informing yourself on the birth and your early postpartum period is really critical.
Oh, I just wanted to give one more plug. We have a birth education class coming up. It starts April 1st. That will help our mothers, through the birth process, and share with them the different things that they, that would help them and help them have a comfort level. Because I think there's a lot of anxiety that come with birth, and it helps when they have an idea of what to expect, knowing that every birth is different.
Mm-hmm. Mm-hmm. And now that you mentioned April 1st, that reminds me that April 1st, tomorrow, Montefiore Nyack Hospital is also going to offer outpatient nutrition counseling to the community. So if you know anyone who would like to get pregnant, needs to lose weight in order to get pregnant, whatever the nutrition needs are, or eating healthier during pregnancy, you can reach us now in Montefiore Nyack Hospital, because we're going to be taking care of these patients as well in a nutrition outpatient service. So extension 2004, just putting it out there just in case, Kara, okay? Okay, well, thank you so much, Kara and Patty. And now, Patrick, back to you, because he wants to introduce William. William, welcome. I love your view. I don't know where you are, but
actually it is a back Zoom background, but it happens to
Okay.
be a actual view from our office in Manhattan. So it's actually a view from one of the windows at the office back at 100 Church
Your
Street. So
your office, where is it? Is it downtown? I thought it was downtown.
100 Church Street.
Right, exactly. So that's
100
downtown.
Church
I
Street.
happened to interview there for a job many months ago. I'm not going to tell you how long ago, but it's a beautiful area.
Well, all I
yeah.
would say is this: had you interviewed with me, you'd be working here with us. I'm just saying. I'm just saying.
Okay, thank you, William. So I leave the stage open for you.
Well, Patrick, go right ahead, Pat.
Yeah, I was just going to say a couple of things really fast. Is thanks again to Sandra and Kara and Patty. I mean, talk about expert information. I'm blown away and appreciative of the fact that you were able to share such interesting information. So again, thank you so much. And we could do this again anytime for sure because it's very beneficial. Just a quick little plug about us and who we are. We're very happy to partner with Montefiore on anything beneficial for the community like today. So this was great. Thank you again. Just to give a quick history, we're new to Rockland in the Mid-Hudson, but we're not a new company overall. We've been around for about 26, 27 years. And we're bringing our positive member experience to the Mid-Hudson. So, again, partner with somebody as strong in the community as Montefiore and the Lower Hudson Valley Prenatal Network is just great for us to do. And, with that being said, I'll let William kind of go over some highlight points about Health First, and we'll let him take it away.
Hi, how are you folks? How's everybody? So first off, thank you so much. Couple of little icebreakers. So first I wanted to just say, where were you ladies when I was having children 27 years ago? I would have loved to have this information. I got 4 kids, 2 grandkids, and I'm looking back going, I did everything wrong. So thank you for that. And as a parent, right, in the spirit of children, a little quarantine joke. I'm sure everybody who has kids right now, I don't know about everybody, but for me, the television has become like a third parent in my house, right?
Mhm.
So we constantly because we're home all day, the kids are home all day. So it's like, hey, go watch TV or something. But I learned the trick. If you shut off the volume and you put on the subtitles, boom, now they're reading. That's all I'm going to say. That being said, let me share my screen and bring you guys into the fold. And let me share a little bit of our journey with you of what we're doing here at Health First, what our focus is, and how we're going to be spending 2021 strategizing and marketing in the Rockland, Westchester, Hudson Valley area. So again, my name is Bill Maynard. Today, I'm going to talk to you about Health First, and just some of our lines of businesses that we offer. So on the PHSP side right now, and what we're going to focus on in the spirit of today's meeting being prenatal care, which obviously is going to be folks more than likely under the age 64. I don't know if many folks having children over the age 64, but I'm sure there is. We're not going to be biased there, right? But that being said, Medicaid managed care, essential plans, Health First Leaf plans, HARP, Child Health Plus. On the Medicare side, the plans we'll be offering is our Life Improvement Plan, our Complete Care, our new Signature Plan, and our Increased Benefits Plan. But for the purpose of today's meeting, we're going to focus on the Essential Plan. So the Essential Plan. First thing to note, we are only one of 2 states that actually offers this program. This program is what I like to call the health insurance gap filler. What do I mean by that? So prior to having the Essential Plan, you either were in a poverty level that put you in Medicaid, or you actually had to go out and go into our qualified health plan and pay a couple of $100. So imagine somebody who's making roughly $17,000 a year, who just missed Medicaid qualifications, is now got to pay a couple of $100 per individual. That could be a pretty hefty nut for a person to pay on that type of salary. So with that being said, the state or the government put out what we call a gap filler, right? Which is the essential plan. So it's going to be for those folks, as we know, many of them tend to fluctuate in and out of Medicaid with just a little bit of overtime, right? And the next thing you know, they're on to that other plan. The essential plan is going to give them an affordable option. Also, this plan is going to address the gap for those folks that are here legally but undocumented. So for those folks, while they're sitting in that 5-year waiting period that we know Big Brother makes them stay in, and they normally don't qualify for anything, there was actually a lawsuit going back several years ago, and it was by an individual by the name of Aliesa, and that's how they've inherited the name the Aliesa population, because the Supreme Court said, guess what? You're right. You are here legally. You are paying taxes. You are doing everything. So hence, we're going to give you an option, and that is known as the essential plan. With that, you got to be the ages 19 to 64. You have to have incomes levels of 17,609 and between 17,609 and 25,520. And if you're below the 17,609 mark, it's for that specific population. Again, it's that undocumented, right? Because if you're not a citizen, you don't qualify for Medicaid. So if you're an individual that is within that 5-year waiting period and normally would qualify for Medicaid, it's the essential plan that is going to be the one you qualify for. With that, some of the highlights for the plan: we have a 0 annual deductible. There are 4 different plan types based on income and immigration status. Vision and dental are available for them. The good news here, no open enrollment period. So I know everybody hears about in October, it's the open enrollment period. You got to rush. The good thing for this and you just can't seem to figure out what their phone number is, or you can't find it, you can go on here and search them by name. Maybe you don't know their name. Maybe you just, you know what, this person spoke my language. You can filter it by language. So there are a lot of different little filters that you can in order to get the appropriate person that you would be most comfortable to work with. Moving right along, our first Health First mobile app. So the mobile app is very new to us, but it's fantastic. So people are able to do their binder payments if they want to change their PCP, if they want to print out a temporary ID card. This is all available to them via the mobile app. The only thing is it would take them about 24 hours from signing up to get the full access and scope, because obviously we have to wait for your information to upload within our systems. And once that happens, you'll have 100% access. And last but not least, another program that we offer is called NowPal. Now, this particular program I think is exceptional, especially during this time of with the pandemic. As you know, many of our seniors, many of our parents that are going out there, especially in the lower income areas, are looking for the food banks. They're looking for the clinics. They're looking for the resources that are available to them in these times of need. And you know what? At the beginning of the pandemic, a lot of these places were closed. And so these people were unnecessarily putting themselves at risk by going out to the public and looking for these resources. Well, here at Health First, what we're able to do is we're able to filter and get you the resources you need, but we're able to let you know which ones are actually open. So there's actually a COVID-19 filter in here that will allow us to basically see if something has been shut down temporarily due to the COVID. But here's some of the resources you can think of. So one is we can take a look at it from a zip code standpoint, or we could take a look at it from what that person's needs are. So if they want to just see, hey, food banks, we can go in and filter it by food pantries, just as the picture depicts here. And it'll show you all the food pantries that are available within a particular zip code or particular borough. But let's say this person says, you know what, I want to know what's available to me on a whole within a zip code. Well, then you might have the food pantries, the clinics, the local level 2 providers, pharmacies, and all the SNAP offices, the HUD offices. They're going to let you know what's available and what's open and which locations are open. So to give you an example, if you take a look at it, for instance, in Brooklyn, you have the Brookdale Hospital, right, that has a bunch of ambulatory sites within their network. And guess what? Not everyone's open, right? So if you wanted to go to the Flatbush office, you couldn't, right? So my point is that we're going to be able to assist people with getting the resources that they're looking for, but sending them one time to one place and them not having to overexpose themselves. So with that, my friends, that is really all I have for you today. I know I rushed a little bit through it, but I know in the essence of time, I wanted to get through it as quickly as possible for you folks. I know we're only scheduled and kind of went 6 minutes over. But if anybody has any questions, I'll be more than happy to answer at this time.
Does Health First support support midwiferys? Like if a person wanted a midwife?
Yes, they do. Yes, I have seen. We do have. We work very largely with the Hasidic Jewish population, who do have a lot of the midwives. So that is something that we do support. Anybody else? Going once? Going twice? But if that's the case, not a problem. Just want to say thank you to Sandra. Really genuinely thank you on behalf of Health First. We truly appreciate your partnership. Patrick, thank you for having me. Ladies, again, where were you 27 years ago? Kind of needed that info. I'm a little behind the 8 ball now, but at least I have it now to pass on to my daughters, right? So with that being said, again, thank you so much. Absolute pleasure. God bless. Thank you for the time today.
Well, thank you so much, Bill, as you said before. And Patrick and Karen and Patty, and tomorrow is April 1st. Today is the last day to make sure you get your colon cancer screening done. Today is the last day of colon cancer screening month as well. Tomorrow, we're going to be talking about colon cancer in our regular community chat on Thursday at 12 p.m. And again, thank you to our panelists. Thank you to all of our attendees. Sorry, we went a little over time today, but this is a very important topic. So I hope you don't mind. And I'll see you tomorrow. Thank you.
Take care, folks. Be well.